We should try to feel, we should try to understand from where the pain is originating. Hi, I'm Dr. Tahmina, your physio, fitness and rehab expert. And today we are going to talk about a very common topic, which is pain. Because everybody must be experiencing some pain in some part of their lives. But definitely we should be knowing the facts about pain, which is very common, but at the same time, sometimes we get misguided because of pain. So what is pain, and should we be scared of pain? Pain definitely is an unpleasant sensation, which tells us that there's something wrong in our body. So should we be scared of pain? No, we should never be scared of pain. Rather, we should try to understand why we are in pain. We should try to feel, we should try to understand from where the pain is originating. Because pain is a signal which tells us that there's something wrong in our body. So basically it's a protective reflex of our body which tells us that there's some tissue damage in our body or there's some nerve compression in our body for which we are having this pain. So we should try to address the pain rather than running away from it. And if we are neglecting the pain, then definitely the pain will keep on bothering us and we start living in pain, which is very wrong. We should never live in pain. Because we need to understand certain facts, like the pain which is originating definitely must be from the muscle or the bone or ligament or a nerve. It can be from anywhere. But at the same time, we need proper diagnosis. Because sometimes we do X-ray, we do CT scan, we do MRI, nothing comes, but still we are in pain. Why is it so? I'll tell you why is it so. Because each and every structure of our body, whether it's muscle, ligament, bone, whatever, is covered by a web-like structure. From our head to toe, each and every structure is covered with a web-like structure, which is called a myofascia. The myofascia is the outer lining of each and every structure that we have in our body. Sometimes if we are injured or we are in some kind of wrong posture, repetitive injury which happens, might give some kind of trouble to these myofascia. It might get contracted and it remains contracted, which doesn't come in any X-ray, MRI or CT scan. That is the reason we are in pain, but still nothing comes in our scans. So in this kind of a situation, what should we do? We should be getting hold of a qualified physical therapist who knows exactly what is to be done in this kind of a situation. Because the concept of rehabilitation, the concept of treating pain has completely changed in today's date. We are no longer in our 70s and 80s where we don't know what to do and how to deal with pain. In today's date, if we are in pain, we should absolutely get hold of a qualified physical therapist and get rid of the pain in just 2 to 3 days. If we can get rid of the pain in 2-3 days, then it's absolutely fine. But if we are neglecting our pain, we are avoiding our pain, then automatically it will keep becoming heavy on us. Because if the pain keeps lingering, then this myofascia keeps on attacking more and more structures, involving more and more structures, and it becomes a larger area. When the pain starts, it starts from one particular point, getting hold of other structures which gets contracted and remains in that kind of a contracted state. So that's the reason that the moment we get the pain, if it's not resolving on its own, we should see definitely heat and cold, some home remedies we can try, we can rest it out. But too much of rest in today's state again is not good. We should not be resting it out for more than 72 hours. If we need to rest, we should rest for more than, if we are resting, we should rest for minimum 72 hours. And after that, if the pain is not resolving, then definitely we need to address the problem instead of running away from it. Hence, the modalities that we use in today's state are laser, there's cupping, there's needling. Dry needling works very wonderful in these kind of pains when it's a myofascial release. So we should be getting hold of a qualified physical therapist when we are in pain. If it's not resolving in 1 week's time, 2 weeks' time, we should not be lingering it further, because then it becomes a chronic problem from acute. So we are only giving trouble to ourselves. So when we are in pain, so we should try to address the problem. We should try to listen to our body. If it's not resolving with the home remedies like heat and cold within 1 week, then definitely it's going to linger. It's not going to settle on its own. So get rid of the problem at the earliest. Rehabilitation have changed. The concepts of treating pain have changed. Get hold of it. Get hold of a qualified physical therapist and understand your problem and get rid of it. Maybe 2 to 3 days you'll be cured instead of lingering it to years and years. Why don't we clear it in just 2 days if we can? So we'll have to get hold of a qualified physical therapist and treat pain, and thereby you'll be pain-free. Thank you.